Hey girl, hey, it's your birth bestie, Nurse Rini, and I am back with another video for you, though it may be the last one for a while. I would like for you to watch this video all the way through because I do talk about fetal heart rates and how some women end up in a C-section because of it. And I also recommend the main videos on this channel that I think are very advantageous for you to watch. I think they're super important and it's something that is not often talked about. Keeping a YouTube channel going is a lot of work, and I don't mind a lot of work, but I don't feel like I get enough views or followers to justify this, though I love teaching and I love what I do. So I'm going to keep the channel up, and I'm also going to recommend a few videos that I especially think you should pay attention to. But before I go, there is just one more thing that I wanted to review with you guys for your information. I do want to say that I think that the reason this channel is so slow to grow is because I'm not giving the fluffy, crunchy, picturesque, romanticized experience of childbirth. I'm letting you know what actually happens in the hospital. And I want that to be my direction always because I want to keep it real with you guys. And I think that not discussing what actually happens in the hospital, not preparing you for what actually happens in the hospital is a disservice to you. And I also think it's one of the reasons that a lot of women walk away from their in-hospital childbirth experience so unhappy. So what you see on the screen is a fetal heart rate tracing. And I know there are a lot of women out there who say they want to have childbirth this way or that way, a very specific birth plan. But I wanted to review with you some of the reasons why we have C-sections. There are many indications for first-time C-sections, but I feel like the most common one that I see is a non-reassuring fetal heart tracing. And I'm going to tell you what that is, but I want to talk about how we sometimes get to that point. So if your medical team is recommending an induction of labor or a C-section because you have some sort of medical situation like gestational diabetes, preeclampsia, or hypertension, they are essentially trying to avoid your baby not being nourished enough in utero. And the way that happens is that your placenta stops functioning as optimally as we would like. So if they schedule you for an induction of labor, yes, you can go on to have a vaginal delivery. But say that your baby isn't growing as well as they should, maybe your blood pressures are not well controlled, your diabetes isn't well controlled. None of this happens to be your fault, by the way. Your team will want to get you delivered sooner rather than later, especially if you are full term. Now, because you're in induction of labor, you will be at a slight increased risk of having a C-section, but sometimes the other reasons that we end up in C-sections is simply because your baby's heart rate isn't tolerating labor because of the disease process and how it's impacted the placenta overall. So I think it was a couple of videos back where I talk about the different types of ways that C-sections happen, including scheduled, unscheduled, as in you are laboring and you turn into a C-section because you're not progressing, or a stat or emergent C-section. So when I would have my patients at the bedside, one of the things that I would do to get them oriented was to review what I'm looking for with the fetal heart tracing. Not so that they could also look for it, but to let them know that there are very specific things that will dictate how they experience childbirth, labor, and the hospital experience overall. So the fetal heart rate is evaluated in 3 buckets. We have category 1, which is good, think of green. We have category 2, which is indeterminate, think of yellow. And then we have category 3, which is terribly wrong, flashing red, red flags on the field, all of that. And that's a stat usually to the operating room. Now, I will say that most fetal heart rates fall in the category 2 bucket, and many people can go on to have successful vaginal deliveries off of a category 2 tracing. But some of the things that can cause a category 2 tracing include a very old placenta, a placenta that is impacted by the disease process, so maybe it has some calcifications, some hardened areas within it. Sometimes babies are laying on their cord or they're tangled in their cord, or even an infection if you have one. So babies have a much faster heart rate than adults do. We are looking for a fetal heart rate anywhere from 110 beats per minute and 160 beats per minute. Anything lower than 110 we don't usually love, and anything greater than 160 we also don't usually love, but there are reasons that those can happen, and it's highly likely that your team will let you know about that. For example, if you develop chorioamnionitis, which is a uterine infection in labor, then usually the baby's heart rate will be elevated along with yours and probably a fever. And there is a video on that on this channel. So on the screen, you see a fetal heart rate tracing. These monitors are in every labor room usually. They are usually in the doctor's call room, at the nurse's station, in the nurse's lounge, and in the doctor's workroom. It is literally all over the unit. We are always watching it, and it really is the meat and potatoes of what we do and how we make decisions in labor and delivery. So the blue line is the baby's heart rate. And remember, I said between 110 and 160. And as you can see, the baby starts off pretty good, but then they have a massive decrease in the fetal heart rate down to, looks like 40 beats per minute. At this point, you can expect that the medical team has descended on the room like SWAT, and they are doing all kinds of interventions to help recover the fetal heart rate, which they ultimately do. So, what are the interventions that we do for what we call intrauterine resuscitation? We can reposition you from side to side, and if that doesn't recover the heart rate, then we get you on your hands and knees like cat cow in yoga. We also increase the fluid through the IV. If you have any kind of medication going like Pitocin, we stop that. We will also give you oxygen through a face mask in hopes that it reaches the baby. And at some point, the doctors may want to put a fetal scalp electrode or FSE internal monitor so that they can make sure that they are getting the correct fetal heart tracing. But based on what I see on the screen, I do think that it is accurate. So you may be asking what makes me think that this fetal heart tracing on the screen is accurate. It's because the purple line is mom's heart rate. And that's the only way we would know whether or not that is an accurate reading for the baby. We see clearly that mom's heart rate is within normal limits for an adult, and we see baby's heart rate reaching below that. At the bottom of the screen, you will see the green line, which are mom's contractions if she's having any. And in this case, she is. Those little hills, those little mountains, little baby mountains, are how contractions show up on the fetal heart tracing for your medical team. Now, don't get me wrong, babies do have decreases in the fetal heart rate, and they also have increases in a fetal heart rate with a return to the baseline or what's normal within that 110, 160 beats per minute. But this decrease in the fetal heart rate, also known as a deceleration, is very scary for everyone involved. But it happens, and so we train and we learn and we do all the things to learn the interventions, and then we make an assessment about whether or not this baby wants to continue with labor or this baby is asking for an immediate evacuation. I think this baby just wanted to make sure that the night staff was up and at him, throwing a little razzle dazzle before the end of the shift, because you can see it says it's 5:40 in the morning. This baby did return to a normal baseline for this period of time, and I'm not really sure how this patient went on to deliver, but it looks like they probably could have stayed in the labor and delivery room and had a vaginal delivery if the heart rate maintained itself. But you're asking, Rini, what would happen if the baby's heart rate did not recover? That is usually a stat C-section, and the team is running you very quickly back to the operating room on the labor and delivery unit. Just in case you did not know, every labor and delivery unit has an operating room or two or three or more on the floor, because when it is an emergency, it is so emergent that we don't have time to make our way through the hospital onto elevators, go downstairs into the main operating room. We need those operating rooms opened immediately, stat. But tracings aren't always this dramatic when it's time to decide to have a C-section. Sometimes you're at an outpatient appointment at the antenatal testing unit and you're just having your weekly monitoring, and maybe the nurse there is monitoring you and she sees something that she thinks might be a little concerning and she wants the doctor to see, and she may want you to stay on the monitor just a while longer to make sure that you are safe to go home. So if your doctor comes to you and says, your baby's not tolerating labor, I think we should go for a C-section, it could be something like this that is the reason. So are fetal heart tracings always so ominous? No. Like I said, most people fall into the category 2 bucket, as does this tracing, and they go on to have a successful vaginal delivery. Here are a few more examples of what a category 2 tracing can look like. So same thing, lots of contractions on the bottom, decelerations on the top. Same thing here, contractions on the bottom, decels on top. But as you can see, there are many variations that a category 2 can show up as. And so we're just always monitoring to best assess your baby as we can from outside while they are trying to communicate from inside. And we're making decisions based on that. And of course, your status as well. With you, we're looking at your blood pressures. We're looking at whether or not you have an infection or a fever. We're looking at how your blood sugars are going. We're looking at everything overall. There are so many different considerations and factors as to how someone experiences childbirth. And really, that's what I want you guys to know. And that's what I've always aimed to inform you guys about, so that you aren't caught up in the maternity wars that are happening on Reddit or on social media. And the reason I have my course is because I really want you guys to know what it looks like in practice in the hospital, because most times people aren't preparing you for that. They're preparing you for the ideal. And I want you to have the ideal, and I also want you to have the realistic, so that you don't go into it feeling like you weren't well informed. A lot of things and a lot of teaching happens in the moment in labor and delivery, and it's hard to absorb and make decisions based on information that you are just learning on the spot. But anyway, guys, I hope this was helpful. If you have any questions, definitely leave them in the comments. Just because I'm not going to post for some time doesn't mean I won't be looking for comments. If you have anything in particular that you want a video about, definitely let me know. But for now, this is it. So like I mentioned earlier on, I want to leave you with some very important videos that I think you should watch that will keep you well informed. This video is about the third stage of labor and a retained placenta, a placenta that just does not deliver on its own. Why it happens and how it's removed when it doesn't deliver on its own. I would definitely recommend checking it out. I just don't remember what thumbnail I used. So look for any of these 3 variations that you just saw. The second video I'd recommend is about epidurals. Definitely, even if you don't plan to get one, I highly recommend reviewing this video for your information. The third video is self-explanatory. I give you tips on how to avoid dropping your baby. It happens more than you think, and I tell you why it does happen. The fourth video that I recommend is the one about C-sections and how to manage recovery. I think it's a very stellar video in which you could learn a lot, and I highly recommend it because most women don't know that they are going to have a C-section. So you just want to be prepared on all fronts. This next video is my most watched video on YouTube. I'm very proud of it, and it's very important. We review fetal kick counts and what you are looking for, so I highly recommend it. The next video is about the intrauterine infection. Usually happens in labor if it's going to happen, and it can absolutely change the course of your labor and how you experience childbirth, so definitely check it out. This next video is about GBS, or Group B strep, or Group B streptococcus. This is something that you get tested for, a bacteria, in your 30-something week of pregnancy in the office, and it will also change a little bit how you experience childbirth and what medications you may need to take while you're in labor. And last but certainly not least is newborn jaundice. I would definitely recommend checking out this video because all babies are at risk for jaundice, some more than others, but it's still good to know what to look for once you go home from the hospital. And that is it for me, folks. I do think all the videos on my channel are very informative and have a lot of good information in there for you if you are interested. If you know someone who's pregnant, feel free to share it with them. And lastly, check out my website because I still also have free videos on there as well. My website is yourjourneybirthcollective.com. And again, if you have any questions about any of the videos, just leave them in the comments and I do respond. Or you can email me at educatedbirths@gmail.com. And I wish you all the very best and happy